Everyone today, and thank you for taking time out of your busy day. I'd like to firstly acknowledge the traditional landowners on the land that we meet, the Bunurong and the Wurundjeri people of the Kulin Nations, and pay my respects to their elders past, present and future. I'd like to warmly welcome our three speakers today, and I look forward to hearing from Ro Allen, who is the Victorian Gender and Sexuality Commissioner, Jo Ball, the CEO of Switchboard Victoria, and Simon Ruth, the CEO of Thorne Harbour Health. The focus today is on inclusion and diversity, and as we know, we work under the aged care quality standards, and we're expected to focus on our clients' diversity, interests, culture and background so that we can fully understand how to provide a service that meets the specific needs of our individual clients that we're servicing. And we're also obligated to provide an inclusive workplace to our staff and our volunteers. So thank you, Suzanne, for organising today's speakers. We'll take questions at the end, so please use the question and answer box to pop in your questions. So let me introduce Ro Allen. As I said, Victorian Gender and Sexuality Commissioner. Ro is an experienced and long-standing advocate for LGBTIQ Victorians and has held leadership positions in the community and government sector. As founding CEO of Uniting Care Cutting Edge, Ro established Victoria's first rural support group for the young LGBTI people, giving Ro a deep understanding of the issues faced in rural and regional areas. Welcome, Ro.
Thank you, Rita, and thank you for having me today on such an esteemed panel with Simon and Jo. I'm looking forward to the detail that they'll put into the presentation as well. So I also want to acknowledge that I'm on the land of the Yorta Yorta today, and I want to pay my respects to elders past and present, always was and always will be Aboriginal land. I want to talk a little bit about LGBTI inclusion, but particularly in the environment we find ourselves now with COVID-19. I also want to acknowledge that, you know, we found that we had the highest numbers in Victoria yesterday, well into the high 400s, and 5 of those were bus drivers and a cleaner from Flinders Street Station. And I know they're in the metro system, but I know that I want to acknowledge that the frontline transport drivers, community transport community is so important, because we may have a virus, but none of the other services have have lost their need to be able to transport people to essential services. So I want to acknowledge you all and thank you for the work that you're doing in the space. And also acknowledge how hard it is. This is the second wave in Victoria, and I know the first wave was difficult, and this one seems to be having a much bigger impact on everybody's mental health. So I'm just going to talk obviously about the LGBTI community, but I know we've got a lot of allies that'll be tuning in today as well, and just some very broad, high-level reflections about what I'm seeing happening, what we're doing in Victoria. And then I'll hand over to Simon and Jo to talk particularly about their organisations and the responses they're making. So fundamentally, I would say that our LGBTIQ community is a resilient community, and we have had the experience of a pandemic before with HIV/AIDS, and I know Simon can talk about that. So we have drawn on some of those lessons, but the same way, people with HIV and AIDS are immune compromised and some of them have been in lockdown a lot longer than the rest of the community, knowing that they're at high risk and vulnerable. So we're experiencing the same things as the rest of the mainstream community: mental health and suicidation. And I know Jo can talk about the increase in calls to Switchboard, our phone counselling service. But we're particularly seeing that any marginalised group, that marginalisation is being magnified in a crisis. People go back to the basics of what they know, which is often service delivery to heterosexual cisgender being folks that are born allocated sex at birth, which is the gender they identify for their life. So, you know, we often see people going back to the basics, and where some services have been doing inclusive practice, sometimes it's seen as an extra and it's forgotten about. So our communities are doing it tough, like everybody. Family violence, as you know, is up during COVID, and it's certainly been an increase in our communities. And often people don't understand the types of family violence that exists within our within our community, and we have to make sure that our service system is dealing with that. So what have we done? We've funded a few things in Victoria. We've funded Thorne Harbour Health to activate. They already had quite a strong volunteer network, and we've assisted with some money to support that network to be able to provide individual care, whether it's a prescription run or supermarket run or support in the volunteer capacity. We've supported Switchboard in their IT. You had quite old IT, Joe, and we needed to help you be able to have your LGBTI volunteers be able to do that from home and do that isolation. We've also supported Queer Space in food relief. We've supported Kindness Pandemic. If you haven't seen the Facebook page, Kindness Pandemic, go and have a look at that. It's got over 500,000 people. It's not just LGBTIQ, but it was certainly created by Dr. Catherine Barrett, who's a member of our community, and the admin around that have been about 15, I think it's up to 30 LGBTIQ people who moderate that page at the moment. And it's so important that we keep connected in this time, and think about the positive things that are still happening within community. To make sure that we do keep connected, we've also funded Kerry and Dolly Diamond. I don't know if people have heard of Dolly Diamond, but it's a variety show, online variety show that's now once a week. And it's been a way to bring community news. If you just Google Facebook, in Facebook and anywhere really, they're on most platforms. They're going through Federation Square now, as well as Queer Film and Midsummer and all those platforms. But if you have Facebook, you could Google that, Kerry and Dolly, and have a look at that. But it brings artists. I mean, we are a bit of a stereotype. We have a lot of LGBTI community people in the creative arts industry, and of course that's fallen to COVID. So it's a chance to bring LGBTI artists and community information and just connection, because we know how important it is to have connection, which brings me back to your service and transport, and that community transport and that connection. So I know that your industry's done a fair bit of work in this space, and you've got a Pride network, and I think you understand that when you pick up a client, particularly an age client, and I know Joe can talk about the seniors that Switchboard do a visiting program, but when somebody's older, they are often, people I talk to say that they feel invisible. Well, when you're a lesbian, gay, bisexual, trans elder, that part, not only can you feel invisible, but that part of your identity can be invisible as well. And I know it's the personalized support that you give people is really important. So there are just a few of the things that are on the increase in our community, as well as homelessness, and I know Simon can talk about that as well. And what I wanted to sort of finish on was, I suppose, some of the positive things that Victoria is doing right now in the space, because we're trying to continue the work. We know that every day in Victoria, someone who's LGBTIQ is being discriminated against. So we're still working on legislation in relation to conversion practice, the Equal Opportunity Act, to update the definitions in the Equal Opportunity Act around our community. And we're building a Pride Centre in Fitzroy Street, St Kilda. And that's one of the few things. Construction is one of the few industries that's kept going. So if you Google the Pride Centre, you can see the updates there. Unfortunately, we ordered the windows from Wuhan, China. So there's been a few hiccups, and there's been some blowouts of funding and so on, as we've all the crew on the site have had to social distance. So it's blown out some of the costs. But it is a beacon of hope, and we'll have a Pride Centre in Victoria, the first in Australia, that will house both the services you're going to hear from later, but also archives, which is our rich history, which is so important that we'll be able to have on display and accessible, as well as cafe, -18, our youth service, queer film, so many other services, Transgender Victoria, Monash Gender Clinic. It will be a fantastic place that we'll be able to celebrate. I'm not sure when the opening date will be. The opening party virtually just won't have the same feel to it. So we'll need to have probably soft openings and hard openings in that space. We're also launching our 3rd year of a LGBTIQ leadership program, and the participants are about to kick off on that, and we're doing that virtually. And there's still the ability to input into our whole of government LGBTIQ strategy. And we would love to hear from you as individuals or as an organisation or an industry about what's working well in Victoria for LGBTIQ people, but what can be built on, what do we still need to do? And you can put in a submission through the engage.vic.gov.au website /LGBTIQ, or you can fill in the survey as well, which is there. But we would love to hear from you, and that closes on the 3rd of August. So far we've had 32 Zoom consultations with, I think, just about every intersection of our community: disability, neurodiverse, hearing impaired, sex workers. Over 60% of sex workers are LGBTIQ. Asylum seekers, LGBTIQ asylum seekers, rural and regional, you name it. I think we've had a consultation with just about every part of community. And what it's told us is that we are doing well, but there's more to do. And really happy at the end of the presentation today to talk about, ask me some questions and have a discussion about where we still need to build to make sure that Victoria is a safe and inclusive place for everybody, and including the LGBTIQ community. Thanks, Rita.
Thanks for that, Ro. That's very informative. Thanks. Our next speaker is Jo Ball, the CEO of Switchboard. Switchboard is a community-based not-for-profit that provides peer-based volunteer-run support service for LGBTI people, their friends, families and allies. And Jo is a passionate CEO and community leader working in the LGBTIQ service sector. Thanks, Jo.
Thank you, and thanks, Rita. And I'm going to share my screen, and we'll see how that goes. Whoa, that kind of went to... Sorry, can people see me now?
Yeah, we can see you, Jo.
Sorry, the screen sharing the screen seemed to crash the thing.
Do you want me to try?
You can. I mean, I can do it without the screen. I was hoping to share with you all some images. What I might do, I'm going to try something else. I'll try pulling out that cord. Just bear with me. I'll try one more time to share it because it's probably a bit easier if I can
Sure.
Control it myself. Oh, what a world where you have to juggle this situation all the time. I might need you to do it, Rita, and I'll just start talking if that's okay. For some reason, it seems to be struggling for me to share it.
It's okay, Suzanne can work that.
Okay, I'll start. So I feel like, yeah, it's so typical. What's an online presentation without being cut off? Okay.
There we go.
Oh, okay, so this might be an interesting thing because it's not in slideshow, so we'll see how we go. Anyway, I start off the presentation by a picture when we could all be together, and that's us at Midsummer Switchboard a couple of years ago, our group at Midsummer, standing very close together, something we hope we can all do in the future. So my name is Jo Ball and I'm the CEO of Switchboard Victoria. I am transgender, I'm non-binary, and I use the pronouns they and them. I too, like Ro and Rita, I want to acknowledge the traditional owners on whose land we are today. I'm on the lands of the Wurundjeri people of the Kulin Nation, and I'd like to acknowledge that sovereignty was never ceded, and it always was and it always will be Aboriginal land. What I'm going to be talking about today, if you could move through the slide, that would be great. I'm not sure. I've got these fancy transitions in the slide, so I assume they won't work on a flat surface. So if you could go to the next one, that would be great. just want to talk to you about what I'm going to be talking about today. So I'm going to quickly whiz through what are the Switchboard services and what we are doing. And then I just really want to get into LGBTIQ A+ people in community transport and actually sort of try and give some like actual takeaways about the work that you do. So to just explain what the services is that we run, looking at the next slide. There were some amazing slideshow transitions here that have been lost, but anyway, the services that we run are, we run 3 helplines. We run the Q Live. We are the Victorian partner in the national LGBTI phone line that runs every day of the year from 3 p.m. to midnight called Q Live. We're the Victorian partner, and we take the Victorian, Tasmanian and South Australian calls first. We are running a family violence after hours phone line, and we're launching a mental health support phone line that's a COVID-19 response. We run suicide prevention programs. We have an anti-racism project for trans and intersex people of colour. And we run an older person's visiting program and social inclusion programs and activities, which we call Out and About. And that's what I wanted to focus on a little bit more about, is the Out and About program, because I think it speaks to a lot of, I guess, your service users, clients, whatever you might call them. And so going to the next slide, this had a lovely transition. So you're going to miss some things that are on here. It wasn't actually, it was like things layered over the top of each other. But so what is Out and About? It's a home visiting program for older LGBTIQA+ people. So it's older people that live in their home or in residential aged care facilities. And we talk about it as being for older people, but as you know, we support, there's many people who are not older who live in residential aged care facilities. And so we do actually support people who are as young as 40 who live in residential aged care facilities. So it's funded as an older visiting program through the community visitor scheme. But we certainly, if somebody meets the criteria of living in residential aged care, we organise a visit for them. So it's older LGBTI people that are socially isolated in their own home or in aged care facilities, and we match them with younger, well, we match them with a friendly visitor. Actually, that's the criteria, because we actually often find ourselves that it might be people the same age who end up visiting each other. We have a couple of instances where the visitor to the person is actually older than the person they visit. So we actually talk about it as an intergenerational service, an intergenerational friendship. And what I've got here on the right is the, so with our program, we organised a bus, which we needed to independently fundraise for. It wasn't included in our funding for the CVS program, but we organised a bus to be at Midsummer. And so the people in our program to date, we currently support 63 people in the Out and About program. And a lot of those people have never been to a Pride March in their life. And now at the stage of them being in our service, it would be near impossible for them to access a Pride March. By the very nature of being able to get down to Fitzroy Street, being able to march for that duration, sit in the sun, the public toilets, all the things that are necessary. So this year we organised a bus that people met at a central meeting point, and for the first time people sat on that bus who, it might be that people have been out for years and years, but it's the first time in their life that they've ever gone to a Pride March. And for most of the people who participated, they remember a time where it would have been completely illegal to do a Pride March. So it was a really moving moment to be able to provide that service, but it also shows some of the access issues in our own community around the activities that we run, like Midsummer, and the needs that we need to address in order to make our community accessible to people with disabilities and older people. So going on to the next slide is just a picture actually of the Victorian Pride Centre, which Ro talked about, and I was just going to say that that's going to be Switchboard's new home. We will be located in the Victorian Pride Centre, and we're really looking forward to, with our visiting program for older people, that, you know, we'll actually have people being able to come and meet and having a place to go and use the cafes facilities, and, you know, look forward to being in that new location and a fully accessible building as well. So how are we responding to COVID-19 at Switchboard? We've had to change our service delivery. It's been an absolute challenge. It's been extremely challenging. And Rita talked about some of the funds that came from the Victorian government in order to be able to send us our phone line home. And we have sent parts of our phone line home. And in some cases, we've continued on a phone line, thinking that we're running multiple remembering what I said about running multiple phone lines. And with the visiting program, as I'm sure you can easily guess, we obviously can't have people from all around the state going and visiting people in residential aged care facilities, or people who are particularly vulnerable to COVID-19, immune compromised and older people. We can't, that service had to change, and now it's become a virtual service. And that's had huge amounts of challenges, to be honest. Like, there's always an assumption that that you can easily, transform a personal visit into a virtual visit. But we've got people in our communities who we support, in amongst our 63 people who are actually illiterate. And people forget things like that. And when you're illiterate, that makes it very complicated to be able to read instructions on how to access all this technology. Also, there's people who live with dementia, which is complicated to remember how to get online. And also, it's just not the same as visiting people in person. So although we've gone virtual, there has been many challenges that we've had to do. A lot of the time, it's turned into writing letters as well as phone calls. And there's been some beautiful stories of our visitors like dropping off cakes and things in extremely quarantined ways on the doorsteps of people's houses. Because our visitors, the nature of it is we support people across the state of Victoria, and we match them with a visitor, an LGBTI visitor who lives quite close to them, or in regional Victoria, at least lives within an hour and a half of them. We've also been able to work with the Rainbow Connection service at Thorne Harbour to provide additional supports to this group of people. One of the other things we've been doing during this time is playing a role, which is this slide about, is messaging to our community. It's really important that during COVID-19 that LGBTI organisations that are trusted organisations, community controlled organisations, play a role in interpreting and making relevant government messages. And that's where you can see that was when, during the first lockdown, we created an infographic, an easily explainable infographic of the reasons under which you could leave home, which are the reasons now for people who live in Metro Melbourne and Mitchell Shire. We also ran an event called Staying Well Together, and we continue to put out messages encouraging people to do help-seeking behaviour. So going on to the next slide, one of the things that we did was we produced care packages for the people I was talking to you about who live, who are in the Out and About program. We're doing a second round. This is from the first round of care packages we sent out, and we're doing another round today that are going out. And today we're sending people out masks that were made by people in the community. We're also sending disposable masks, we're sending hand sanitizer, we're sending them a copy of Star Observer as requested, and a range of other sort of goodies and treats to go out there, and messages of love and support. And because we've seen a real increase in how people are feeling in our service, in our older person service, but across our programs, are feeling really isolated from community, and people feeling a sense of abandonment and concern. So going on to the, how am I going for time, by the way? I think I'm
great.
Technology. So I wanted to spend this time talking about community transport. So I ran a consultation just earlier this week with our Out and About staff, who are at the front line of, I guess, of dealing with the issues of people who are most likely to use in our programs community transport. And I've made some sort of general comments on the right-hand column there about, which Ro talked about, that people in our community have a pre-existing issues that are exacerbated by COVID-19. So if you were already socially isolated, or had poorer mental health outcomes prior to COVID-19, that's been exacerbated by this time, and including with suicidality. And I've talked a little bit about older people more likely to be, our LGBTI older people more likely to be socially isolated. That's because in that generation of people, there's many things. There's the fact that that is a generation of people that live through extremely repressive conditions in this country. Some of you might know that up until 1945, you could be hung for sodomy, and people went to jail and lost whole careers. And that's the older generation that we are supporting, through our program. People have had pretty hard lives. So you can read those things yourself about some of those comments. I wanted to talk to you about community transport, about what the Out and About program had to say. And firstly, I want to really say that I understand that the community transport sector is not an overly funded sector, that it's an underfunded sector. And, we have that in common with you. So any comments I make, it's within the context of understanding that you too have your financial struggles. And so I'm just going to comment. I know that, some of the things I was saying are linked to, funding issues. I guess one of the issues for community transport in our community is, with the volunteers, with your own volunteers that are running these services, it's very hard to get and run ongoing training for those volunteers on LGBTI inclusive practice. And that, it's something that, you've got a lot of training you need to do. And it's something, can be very hard to fit into training courses. We understand that, but it's also very important. Also the LGBTIQA plus people, particularly older people, across the ages, but they may not trust the service that's providing transport. They may have had an earlier bad experience with the parent organisation of the service. For example, if it's run by faith-based charities, which have a history of discrimination, or if that organisation is openly still making discriminatory comments about our community and is providing a community transport service, or they haven't made recent affirming statements about our community that people, older people and people in our service might think, well, that's not a service for me. Or if I go on that bus, what kind of treatment am I going to have? And it might be it might be a historical sense of the organisation rather than its contemporary policies and procedures that it has. I suspect that, it's very hard for community transport organisations to engage in the rainbow tick. And I would love to hear more from you guys about that, really. I know that process can be labour and financially intensive, but without sort of a system under which to take inclusion, I think that's very complicated to address the issues across the service. And I wanted to leave you with a comment about, I guess, what it means when our people in our community, and this is from one of the people in our Out and About program. We have somebody who needed to attend an appointment. It was an older person that needed to attend a medical appointment, and they were given the option of access to community transport. They lived in a rural area, and they just felt like they were just quite scared of accessing that service and making that contact. And instead, they spent $300 in a private taxi to attend a service. And, that's a direct story that we've heard of someone. And the other stories we've heard is that people skip appointments or miss appointments because of the anxiety and fear they have of what's the experience going to be of that service. So that was just a consultation I ran with the staff. I'm going to wrap up because, and if people want to ask me really specifically about these questions, I'm happy to talk about it more, or maybe we can even have a really offline conversation with individual providers about ways that we can work together. That's the end of my talk. And
thank you. Sorry, Joe. Did you want to say something else?
No, just thank you. And I'll hand over.
Terrific. Thanks, Joe. That was very informative. I didn't actually realise you did community transport, so we share a common ground with just community transport, volunteer coordination and delivering services to older people. So that was great to hear. Our last speaker is Simon Ruth, the CEO of Thorne Harbour Health, which was previously the Victorian AIDS Council, which I think everyone remembers was a HIV activist organisation, and it's grown into an organisation governed by its members and working for people living with HIV, as well as their sex, sexuality and diverse communities, promoting a healthy future. So welcome, Simon. I think you just need to turn off your mute.
There. Can you see that screen now?
Yes.
Yes.
Yep, pop it in slideshow. That's it.
Hold on. This is my first time ever sharing a screen, so it's an adventure for me. Okay. Slideshow. How's that?
That's it.
That's it? Great. So as Rita said, I'm Simon Ruth. I'm the CEO of Thorne Harbour Health. We were formerly the Victorian AIDS Council, which many of you might have heard of. We're a member-based organisation, and we're still a largely volunteer-run organisation. We have about 8 volunteers for every paid employee within the organisation. And HIV activism began in Melbourne. We are the oldest HIV organisation in Australia and also the oldest LGBTI health organisation in Australia. And we started on the 12th of July 1983, so it was actually our 37th birthday just over a week ago. About 18 months after we started, we actually started before the first AIDS case happened in Australia, and it was only a matter of weeks before that occurred, but in about 18 months, every state and territory in Australia had a similar organisation to ours. We did change our name a couple of years ago to Thorne Harbour Health, and that name honours Alison Thorne and Keith Harbour. Alison, some of you may remember the name Alison Thorne. Alison is responsible for the creation of our organisation. She was the person at a public meeting who stormed the stage and demanded that we form an organisation. And shortly after the formation of our organisation, Alison had a not great interview on 3AW about another issue, and 3AW started a campaign at the time to have her terminated as a teacher. She was a teacher in the public education system. She was stood down from teaching duties, and she then fought a 4-year battle to be reinstated as a teacher. And the Equal Opportunity Commission at the time found that she had been stood down for being an out lesbian, and it's a landmark discrimination case in Australia. And Alison's still with us. She runs an organisation called Radical Women and is involved in a far left political party in Australia. Keith Harbour was one of our early presidents. Keith formed ACT UP in Melbourne, the AIDS Coalition to Unleash Power. If you've ever seen the movie Dallas Buyers Club, Keith set up a similar system in Melbourne where he imported drugs that weren't currently available into Australia and distributed those through GPs who worked with him. And Keith then actually died of AIDS in the early 90s, but did receive an Order of Australia medal just before he died for his services to the community. He is our only president ever to actually die of AIDS while he was in the role. And the name change represented a shift from being an organisation largely focused on HIV and AIDS to becoming a much broader organisation focused on LGBTI health. We do operate in 2 states, where in Victoria and in South Australia. In South Australia, we're called SAMESH. We've got sites in Melbourne, 4 sites in Melbourne, 1 in Bendigo and 1 in Adelaide. And we have operated community transport since 1983. So it was one of the very first things we ever did. We set up volunteer teams to support people who back in 1983, it was people who were terminally ill and dying and were often rejected by their families. You need to remember that 1983 is only a couple of years after it was decriminalised to be gay in Victoria. So a lot of these men at that stage who were incredibly unwell, rejected by family and friends, often thought of as being highly infectious. And there were volunteer teams who supported them, helped them with their shopping, drove them to medical appointments and provided incredibly necessary care. And we still provide that service through to today. This is the sort of thing, if you don't know us, these are the sorts of things you may know us for. So we also do public health promotion campaigns. There for us is a broader rebranding campaign. You may have seen HIV Still Matters, which comes out around World AIDS Day each year. The one in the middle, though, is currently up around Melbourne and parts of rural Victoria. You may see that gentleman with 6 other gents in a billboard all jumping, or you may see them individually around bus stops and tram stops. I know his name is Shannon, and I know I pass Shannon twice on my way to work each day as I drive up the Nepean Highway. A little bit about HIV. So HIV in Australia, there's roughly about 30,000 people living with HIV currently in Australia, about 9,000 or slightly more of those live in Victoria. We think in Australia there's probably somewhere close to 3,000 people who are unaware of their status. Each year, 800 to 1,000 people get diagnosed with HIV. There has been a decline over the last few years. Treatment is highly successful with HIV. So we now have treatments where we can get you to what we call undetectable, where you can no longer pass on the virus. So if you maintain your treatment, you can get to the point where you're no longer can give it to somebody else, and you can live a long and happy life. Men who have sex with men, gay and bisexual men, are disproportionately affected by HIV in Australia. And the vast majority of people who contract HIV within Australia are men who have sex with men. You'll see there, the orange dots are heterosexual people in Australia with HIV. They are largely, not all, but largely migrants. They're people who arrive in Australia with HIV, and it gets either picked up during the migration process or they knew before they came. There also is now a pill that can prevent you getting HIV. So it's a pill called PrEP, pre-exposure prophylaxis. And if you think you are at risk of HIV, if you're a sexually active gay or bisexual man, if you're planning on traveling to part of the world with very high rates of HIV and you'd like to protect yourself further, there is a pill you can get prescribed by any GP that will provide you almost 100% protection against HIV. Australia is doing very well, where our HIV rates are actually incredibly low. We're one of half a dozen countries that have virtually almost eliminated HIV. And the last thing there, women tend to get diagnosed late because our epidemic in Australia is so heavily focused on gay and bisexual men. Women with HIV, often it takes years to get doctors to agree to test them. We have a video that if you go to our website that you can see of a woman talking about her story where she actually asked repeatedly for a HIV test and her doctor kept telling her she didn't need one. So it took months longer for her to discover that she had HIV. And that is simply because of bias within the medical profession and people not actually understanding that everybody is actually at risk of HIV, even though we have certain communities with much higher risk. The other services we provide, we provide medical services. We run a service called Equinox, which is the largest provider of transgender health in the country, which is a GP service running out of Fitzroy. We have a range of counselling programs. We do health promotion, and that's an example of a campaign we did with Vic Health that looked at, it was particularly rural same-sex attracted women and their drinking levels. We know that rural lesbian and bisexual women drink at a high rate, so we developed a campaign there that focused on them. We run family violence services, drug and alcohol services, a range of women's health service, a national women's health conference. TGD is trans and gender diverse, so we have programs that focus on that. Sexual health, we provide training. We run a range of peer support programs and then support other groups to develop as well. And there's a lot of smaller organisations that we auspice. It's a lot of work to run an association, as many of you would know, and there's a lot of smaller groups who aren't up for running all the functions of an organisation and maintaining all the legal requirements. But from time to time, they want to access small amounts of money, and we provide the auspice for them to do so. And so money comes to us from government or elsewhere, and we pass it on. Most of our services have had to change due to COVID-19. They were largely face-to-face programs. They've now moved remotely, which is great if you live in a rural or regional area or an outer urban area and you want to access this. But it's not great for everybody. We're still trying to figure out who's missing out on services. We do have the service Rainbow Connections, which Rainbow Connection, which Ro mentioned, where the government gave us some money, and where any isolated LGBTI person at this time can ring up and we will provide social support. And if they need support with housing or meals or picking up medications and those sorts of things, we will try and do what we can do. If you go to our website, thorneharbour.org, there's details on there, or you can just email rainbowconnection@thorneharbour.org. We do need better mainstream services in Australia, but we also have a need for services like mine and Joe's, which are LGBTI community controlled. We are one group that is still legally, under certain circumstances, you can legally discriminate against our communities. And, you know, the federal government is moving to broaden the legal ability to discriminate against parts of our community. And I guess the other thing to talk about is that LGBTI people aren't one community, we're multiple communities. The issues vary greatly depending on whether you're talking about gay men or transgender women or the intersex community. An issue like HIV is very much an issue for gay and bisexual men. It's not an issue for lesbians. And the trans and intersex communities have very different issues as well. And once you overlay disability or ethnicity or faith over those, you get more and more complex issues coming up, and which again fragments our community into a range of much broader issues. And I'll finish up there. So that's just our website. Go along, we have an entire page of information about COVID-19 and what it means for you in a range of different areas, and the referral pathways to all of our services are available there.
Thank you, Simon. That was very informative. I just encourage anyone, if you've got any questions, to pop them in the question and answer box. At the moment, there doesn't seem to be any. Joe mentioned before about organisations that are looking at rainbow ticks. Bridges has been looking at it. We started 2 years ago, applied for funding to get a worker to come on board to go through from the top of our board down through our organisation and put an inclusive lens across everything, changing our marketing material, our policies, our procedures. And then we did a quick comparison to the LGBTI standards, and we found we were 85% there, but we were really short on our training. So we applied for more funding to bring in another worker who could do some inclusion training with our volunteers and staff and our end clients. And so that's happening at the moment, and we've contacted QIP, who were going to give us a quote on coming in and having a look at what we've done and if we are sort of close to our rainbow tick. So that's where we're at the moment. But yeah, it's a big road to go down, but it's very satisfying. I know when we started it, our volunteers, who I had spoken to on numerous occasions, all of a sudden started coming up to me and telling me that they had a family member who was gay, and they felt very comfortable talking to me. And I thought, this is really what it's about, isn't it? Getting to know people on a deeper level and understanding, you know, where they come from and the diversity that there are, life experiences within everyone, and appreciating it. So
we are a community that is everywhere, and
yeah.
you know, you'll never know who we are or where we are, you know, which is why you need to be all the more careful about comments that you make publicly or jokes that you make in the community. I mean, many people in our community don't come out till much later in life. So my service and Joe's service both deal with people who are in their 40s and 50s and coming out of the closet.
We've supported a number of people that have come out for the first time living in aged care. We've had people transition medically in aged care. And it's a really constant battle we have, is that people think that, you know, I think old people and people with disabilities are often desexualized regardless of what their sexuality is. But there's often assumption that older people and people with disabilities are straight. And, you know, like when we do our end of year Christmas party, there's such a mix, which, you know, we'll be doing a virtual one this year, which is a bit sad. But when we, you know, every year that we do the thing, like you look across the room and there's some people who literally come draped in a rainbow flag, some older people who come to the Christmas party and they've got their rainbow outfit on. And you've got other people that you would just, if you saw them in the street, you would just go, that's somebody's grandfather that, you know, is straight. And you might even have a thought about, oh, he's an older man, he's going to be, he's going to have some bigoted ideas. You know, but actually he's coming to our Christmas party, and you know, he's been a gay man, you know, his whole life, and that's maybe and out in different ways. And I think that's really important, is to never assume that that people are not part of our community, and start from there. And I think you know, that's definitely an issue we get in aged care, as we go into a residential aged care facility and they say, oh, that's all very nice and good. And some of you might even be listening and thinking, that's all nice and good. You might be thinking the same thing as this, but there's nobody on my pickup. There's nobody that I support that fits into this criteria, because I know that blah, blah's got children and that person's got children. But all those kind of assumptions, all the LGBTI people can certainly have children. That doesn't determine their sexuality and gender either. So I think it's just, yeah, just having those things in your mind, and understanding the consequences of one kind of non-intentional but bigoted statement about assuming somebody's sexuality and gender, you know, that might stick with them for the duration that you are supporting them under, and that they may never come out to you because of sort of that comment. And I think that's a thought I guess would leave people with. But we can't expect people to be able to, and competent to respond to those scenarios unless we provide them with training as well. Like, so I just, you know, back to what I was saying before.
Yeah,
I think Joe, you alluded to it, but certainly people with a disability aren't even seen as heterosexual or having a sexuality, let alone homosexual. So in the disability sector, we've been doing a lot of work and hopefully making it better for everybody in that space.
And can I just add, I think it's incredibly important. Volunteer organisations have an amazing role to play. Just by existing and putting a rainbow flag up or a rainbow sticker on your door, doing the rainbow tick. I didn't know any LGBTI people before I went to university and came out, even though I'd known I was gay for many years. I'm sure Joe and Ro are both in similar positions to me. And often when you decide to come out, you need to find community, or you need to find people who you're not terrified of telling. And when people say, when did you come out? Well, you come out all the time. And sometimes you don't come out. You go and see a GP you've never seen before. You know you're only going to see them once, and they ask you about your life and you think, oh, do I really want to tell them about my life, to have them stare at me, to have me misread the stare, or to have them say something to me. And we do get that. You know, we had a GP tell a young man not that long ago in a rural part of Victoria to go see his priest when the young man said he was gay. You know, you don't want that reaction, but friendly volunteer organisations where I can walk in the door and say I'm gay and not be stared at and not be discriminated against play a phenomenally important role, particularly in rural and regional areas where you don't have the organisations like ours that you can walk into. So volunteering is incredibly important for people. And often, you know, the other places when you don't grow up in our community, and where else do you go? You go to churches for community, and churches are often scary places for our communities, and you go to sporting clubs, and sporting clubs are also often scary places for parts of our community. So volunteer-based organisations like a lot of yours are phenomenally important.
that's great.
Can I
Thank
just
you.
add a couple of things, Rita?
Go for it.
In regards to the rainbow tick, we understand that it is quite cost prohibitive for a lot of organisations who deliver community transport, and Dr. Catherine Barrett came along to our conference in October last year and did a presentation which was aimed at providing you know, really simple suggestions, or potentially simple suggestions on how community transport organisations could go, you know, make great inroads into being more inclusive and embracing of diversity, while not necessarily going for the rainbow tick. But the things that are within the rainbow tick that they could do that are not going to necessarily cost them to, or, you know, have to invest in doing the rainbow, trying to achieve the rainbow tick accreditation. So that's something we can, you know, share around again as well. And I just wanted to address Joe in, you know, it's just so fantastic to see that you did some consultation with your team, and the feedback that came from there. It's concerning, but I'm sure it's not necessarily an isolated incident, that someone in your service didn't want to, or you know of someone who didn't want to access a community transport organisation through fear of, you know, that not being a great experience. and I wonder whether there's ways we could help provide linkages or brokerage between you know, your organisation and the people who work there and the people that you work with. And if, you know, that particular situation arose again, if we could help, you know, provide linkages there. But so I'm really keen to talk more about that and how we can work more with all of, with both Thorne Harbour Health if issues come up and with Switchboard.
That sounds really good. And one of the things we see in a lot of our community, and that was part of the consultation, is just people in the Out and About program just thinking that mainstream services are not for them. And I'm sure Catherine Barrett went through some of that, but if you just don't see any kind of imagery that gives any idea in the program that it could possibly be for you, or you know, it is provided by a faith-based organisation with no sort of like maybe a rainbow flag on the bottom, or, you know, like something like that, something to say, yes, this might be provided by this organisation that you've got some fears about, but, you know, it is for everybody. And I think that's, organisations have to work out that for them, you know, work through that for themselves about how they can do that. And also I think sometimes organisations get really worried. Something I hear when I talk to organisations, they get really worried about who they'll exclude if they're inclusive to us. For older people, that's what I hear from aged care providers, that, you know, genuine concern that they're like, well, you know, if we put on a rainbow event, we're going to offend, you know, our other clients. But sometimes I just find that's quite an unfounded, that it's, you know, like I ask people, you know, what evidence do you have of that? And it's more like, oh, it's a feeling I have about blah, blah in this room who has this opinion. And I just sort of think, oh, really? Like, you've never given it a go? So I think, you know, I don't know if that's something that's in people's heads as they're listening about who would be excluded if we're inclusive. But I know that can be a hurdle. And I guess it just has to come from a rights-based perspective that, you know, LGBTI people, you know, have a right to access these services and to have affordable, you know, transport options that in many cases are life-saving.
Yeah.
I want to put a provocative point in there that I've come across in aged care. I wonder if that's resonated with anyone who's listening.
I missed that, Jo. Could you just say that last bit again? Sorry.
Oh, I was just saying, I wanted to put that as a provocative point, I guess, to anyone who's listening. I was wondering if anyone who's listening in, that idea resonates with them, because I bring it up because it's the experience we have in aged care. And I think, yeah, I wonder if that's a concern that community transport providers might have about that being inclusive is a barrier. And I know that's might be confronting for people to address that issue now, but yeah, I think we've got to look at the barriers under which, why you don't do it. And some of them are definitely funding, but some of them are other concerns.
I think sometimes someone has to be the person to take it on. I know in my organisation, inclusion came from me seeing a video of a older gentleman who, you know, was in tears. He'd been arrested in his because of it being illegal to be a homosexual back in the 80s. I did not know in 1980 that it was still illegal to be a homosexual. Well, it was illegal to be homosexual. And in the 70s, I watched The Box and Number 96, and those characters in there were homosexuals. That's where we learnt about it. And so for me, I was devastated to know that this man had gone through that, had a record that wasn't expunged, because when they came out, that the government hadn't got rid of their criminal records. And for me, that was tear-jerking and emotional, that a person then comes into aged care and doesn't feel safe in a government-funded organisation because the government had done that to them to start with. So for me, it was, I took that on, and I would suspect that there's organisations where you just need someone to be the champion to take it on and to run with it. And I think that the barrier is, you know, time. You're time deficient, you're money deficient, and you sometimes just don't have that person willing to take it on and run forward with it. But that's just from my perspective.
Yep. And I think, you know, most LGBTI people.
We totally need the allies.
You go, Ray.
Sorry, Simon, do you want to go?
Oh, I was just going to say, you know, most LGBTI people have had a bad experience.
I just wanted to say we do need those champions.
Yeah.
And I was just going to say most LGBTI people have had a bad experience at some point. And so we need organisations that are prepared to go that step further, because a lot of people are so scared of having the bad experience again, they will avoid contact. So it's not just about an organisation discriminating, it's also about the community perceiving they're going to be discriminated against. So sometimes just having a rainbow sticker on your door is enough to let people know you actually can step inside.
Yeah, and I think that's right, Simon, is that people don't, and that you've got an intention to get it right. I think that's the other thing, is it's like none of us get it right all the time. Like none of us, you know, in this, the three of us, Simon, no, we don't get it right all the time for everybody in our community, but it's that we have an intention towards it, I think, and that's what we're always trying to signal. And, you know, we have our own inclusion issues that we've talked about, like disability inclusion, older people inclusion, Aboriginal and Torres Strait Islander inclusion. You know, this mission of inclusion is all of our work, and it is for us. And we understand the same struggles. Like, you know, absolutely. I'm always looking for funding so we can do, for example, a reconciliation action plan. You know, like, so I understand it. I do completely understand the struggles around it, but little things that we can do can make a huge difference. And one thing I wonder if it's worth sending around to you, Suzanne, that you could decide whether members should get this, but you know, we've produced a range of materials about older LGBTI people. Like we've produced a podcast of older LGBTI women and non-binary folk talking about their experiences. And that's, you know, and there's also an ABC video about Hayden and Clinton that's about our service, and it shows you what visiting looks like. And I wonder about, you know, maybe some of those resources, people could implement them into their training. And I mean, we can send it to you and you can decide whether you think it's good things to send out. But there's some great media, I think, that has been produced that can, because I think you're right, Rita, about sometimes you just got to really see that humanising element. Yeah. You've got to find the thing that connects to somebody that makes them sort of think this is going to be an issue I care about.
Mm. Yeah, and I think you've got to see that there's a person at the end of all of this. We have the words LGBTI, but people don't see that they're people underneath all that, that there's a person, someone's child, someone's father, mother. Yeah, and as you said, you've got to get to that level to understand. Yeah.
Yeah, we can absolutely share that through the newsletter and through our social media channels, and opportunities, I think, for VTCTA to lead some training around.
Certainly.
Yeah, whether it's to connect, and we often share that information from, especially from the Eastern, what's the group called?
It used to be, it's EDST, Eastern Development Sector Team.
Yeah, so from Dale Park, but I think there's lots of opportunities to continue to work together from here.
Certainly.
We don't have any other questions. Well, we don't have any questions, which is not unusual, and I don't think it's a bad thing. Yeah, so I think we're good to go unless anyone's got anything else they'd like to add.
Can I just say thank you, Ro, Joe and Simon, for investing your time today and sharing your experiences, your knowledge with us, and we've really appreciated it, and I just can't thank you enough. It's sad that we have to end the conversation because we could go on for a little bit longer, but thank you very much.
Well, you know, I think it's just the beginning. Thank you. And
thanks so much.
Through those resources, and, you know, yeah, I've got some homework. Love that.
Terrific. Thanks for that.
Bye-bye. Pleasure.
Okay. Thanks so much.
Thank you. Thanks, Suzanne.
Bye. Bye.
Bye.